Hello and welcome to this presentation on how to use an insulin pen with a safety needle tip for in-hospital use. I want to acknowledge with gratitude that this presentation was created on the unceded homelands of the Musqueam, Squamish, and Tsleil-Waututh First Nations, and to thank them for their stewardship of these beautiful lands over time in memoriam. So insulin pens are either in a reusable or disposable format. What you're going to see in hospital, though, are disposable insulin pens. There is an occasion because of 3070 not being available in a vial anymore that it will be sent up in a reusable pen, but it will not be reused. So in the hospital setting, we would not change out those cartridges. Each cartridge holds 300 units of insulin. So when all of the insulin has been dispensed or the patient has been discharged, the entire pen is going to go in the pharmaceutical waste dispenser. When we use cloudy insulins like NPH or premixed insulin, we need to make sure that we mix this insulin and we turn it topsy-turvy here 10 times back and forth to reconstitute the insulin. And then the insulin should look milky white. So the parts of the pen are that the cartridge is contained within a sealed container of the disposable pen, that there is a dose dial on the end, that you can turn this dose dial to the desired dose, and that there is a tip here that the insulin pen needle tip is going to go on to the end. The cap, it should be stored with the cap on when you put it back in the patient's medication drawer, and that just keeps everything clean. So we are using across BC the AutoShield Duo safety needle tip for in-hospital use. So if you are injecting a patient with insulin, you should be using these needle tips. You should not be using the home needle tips, which is in another video. These are non-safety needle tips, and that should only be if a patient is self-injecting. So these AutoShield Duos, they have a paper tab on the end that you would rip off when you're ready to use it. And I'll point on the slide here that you've got this white sleeve and a clear safety needle cover that is going to retract the minute you put pressure on it to put it into the skin. So that outer sheath is going to kick back up and allow the needle to pierce the skin and go subcutaneously. There's an outer cover that will keep the needle covered, that is discarded in the garbage after you use it. And then after it is used, you're going to see a difference here in that there's no red band across the safety needle that hasn't been used yet. But once it's been used, there's a lock that clicks into place, and you'll see the difference here is that there is your needle underneath this clear sheath, and the sheath is wide. Whereas here it looks more nipple-like, and that it has covered and locked the needle on the end so that there is zero chance of you having a needle stick injury. And then the needle that allows the insulin to come out of the pen on the other side of the needle tip is covered with a retractable orange safety shield. So there is no possible way for you to poke yourself. These have never failed, and so we're quite safe using these. So in order to attach the AutoShield Safety Dual needle tip to the end of the insulin pen, you're going to want to remove the cap. You cannot insert the needle on top unless the cap is off. The next thing you're going to want to do is wipe the end of the rubber stopper with alcohol. Because of nosocomial infections, it's important that we keep things nice and clean in the hospital setting. So wipe that with alcohol each time. Get in the habit of that. The next thing you're going to do is take the AutoShield needle tip, and there's a little tab on the end here that's a grab tab. So if I grab that and pull it completely off, don't leave any hanging. I need the full circumference in order to get that around the end of the needle. You want to take the pen and or the needle tip, put this straight on. Don't put this on an angle, because if you try to put it in on an angle, it could bend the inner needle that is allowing the insulin to come out of the cartridge and into that reservoir there for being injected. and you want to make sure that you've put this on nice and straight. I have had people who have twisted down. When we twist clockwise down, righty-tighty, lefty-loosey, they've tightened it so much that they've broken that needle off at the base here. And that means the entire pen has to be discarded and a brand new pen dispensed. So snug, but not too tight. You have to get it off again afterwards. So now we want to remove the outer cap. That can go in the garbage. And the next thing we want to do is an air shot. We want to make sure that the insulin is going to come out of the needle, because there's nothing worse than getting that on the skin and now all of a sudden it's not working. You need to test it before you put it into the patient. So the first thing we're going to do is dial this dose, this pen on the dose dial at the base here. We're going to dial it to 2. If it's a brand new pen, you may need, I've had up to 8 units that I've needed to do an air shot. So I'm going to start with 2 here because I know that this pen doesn't need 8 units to do a prime shot. And this is to make sure that the insulin is going to come out the needle when you need it. So I've dialed it to 2. I'm going to push this dose button and I'm going to look for insulin to come out the top. And hopefully you can see this. Probably not. And there were some drops of insulin that came out the top. If I do this more, you'll see a stream of insulin come out, hopefully. There we go. And some of that insulin from the air shot may have fallen back around the inner base here. So what I suggest you to do is Taylor Swift it and shake it off. Get rid of that excess, because when you flip this pen over and put it into the patient, there'll be that insulin that you did from the air shot dropping back onto the skin. You're going to come away from that pen after the injection and say, oh my gosh, did I get it in there? Because there's insulin on the skin. So if you do a little shake before putting it into the patient, that will limit the amount of that air shot that fell around the base and the liquid that is there. So now we know that this pen is going to work properly because I've done an air shot. So our next task is to pick a spot. So anywhere where there are some chunky monkeys and good absorption, we can go. So the belly is a good spot, and do notice that there's real estate above and below the belly button. We just don't want to go within an inch or 2 of the belly button. So we want to make sure that we are getting some subcutaneous tissue. We're not going into scar tissue ever because it won't absorb properly. And we can use all the way from the side around to the back to the love handles here. We can inject in the thighs, but this should actually be more around the side of the thigh than on the front, especially in a muscular person who's got some pretty good quads there. We want to make sure it's going into fat tissue and not into the muscle. You can also inject in the back of the arms, not in the deltoid, okay? The back of the arm. This is kind of a nice break for somebody who injects insulin at home because they can't get it in the back of the arm very well. So they're usually using their belly or their bottom or their thighs, and this gives those areas that they normally use a break. So we also want to make sure we're not injecting into any lipohypertrophy or lumpy bumpies. This is where insulin is repeatedly injected into the same spot, and because it's a growth hormone, it makes that area hardened and bigger. And there's another presentation on lipohypertrophy within this series. So you want to make sure that the skin is nice and smooth there, and that there are no bumps or pitfalls in the skin. It really can change the amount, how the insulin is absorbed. So now that we've picked our spot, we need to dial up our dose of insulin to what it is that is on our orders. So this dose button, if you turn this, it will tell you exactly how much insulin you're giving. It goes up in increments of 2. So every, it'll say 2, 4, 6, and then there's slashes in between that will indicate 3, 5, 7, etc. There is no possible way for you to inject more insulin than is left in the cartridge. This will stop when there is not enough insulin to get out of the pen. So you can't over-inject insulin unless you choose the wrong dose. Okay, so if I've dialed my dose, and let's say this one is 14 units, I want to give 14 units. I've done all my checks and I'm ready to go. So I've picked my spot. The best way to hold this pen is for that dose window that tells you how much insulin you're giving to be facing towards you. You're the one that has to see whether the dose button has gone down to 0. Hold it with the 4 fingers of your dominant hand, whichever one is stronger for you, and keep your thumb free for the top. When you are trying to do an injection in another way, you don't have as much stability as if when you use your 4 fingers to stably hold the base of the pen, the barrel of the pen, and have your thumb ready for injection. Don't press yet. You want to wipe the skin with alcohol wherever you're going to be injecting, and then here's what you're going to hear when you go in. There's a tiny little click that when you push the AutoShield Duo in and retract that outer sheath back, it will click. Okay, you heard a little click there. Now I'm going to press the dose button until I watch it go down to 0. Although I need to stay in for 10 seconds, I don't need to sit there and hold this button down for the 10 seconds. That's going to hurt your hand after a while. You can release your finger because it's down to 0, stay in for 10 seconds, and then when you release, there's a very soft click, not as marked as the other one going in, and you're going to see a red line that's going to appear. So I've pulled this out, and now I have that red safety band that is along the base, and it now is in a different shape, and I cannot poke myself. If someone is very thin, then you can perform the pinch method. It is not needed for someone of normal adiposity. You do not need to pinch because of the short needles on here, the 5mm needle, there's no need. So if somebody is very thin, cachectic, young children, you're going to want to make sure that you pinch up. I just want to point out that if your fingers are too close together, it will actually grab the muscle and the skin at the same time, and that's not a pinch lift when you're pulling the muscle. And that also is a risk for you going in with a needle to poke yourself. So you want to make sure that you're just pulling the skin up, okay, not the muscle that goes with it. You're going to perform the exact same steps that we just walked through, inject the insulin, and then remove the needle. So now when we take the needle off, we are not at risk for any poking. So once that red band is on there, I can't poke myself. I could poke myself once when it's brand new, because you know that outer sheath will retract, but I can't possibly poke myself here when it's locked. I want to counterclockwise, righty-tighty, lefty-loosey, and it pops off because there is a spring-loaded alternate cap on the base to make sure that there's no risk of you poking yourself on the inner needle if you stuck your finger in there for whatever reason. So this is now, both ends are now protected with a safety cover. That is then thrown in the sharps container. Even though it's not a sharps risk, it is a biohazard. We want to make sure that we're counseling patients not to share insulin pens, and ourselves, we never want to try to share a pen from one person and put a new needle tip on top and share it with somebody else, even though it's the same type of insulin, because this allows through and through, right from the patient into the actual insulin cartridge. In vials, traditionally you could share them in the past with less risk, because when you're putting a syringe in, it's actually pulling out the insulin and then transporting it over to the patient. So there really is not that risk of cross-contamination when you use a brand new syringe each time. However, we have gone to best practice, which is using, if there are any vials, we're using them individually for the patient. So we want to make sure that we're not sharing any of these insulin pens. And that is the instruction. I hope this has helped. Thank you.